So today we'll discuss about the new chapter. It is called as the biotransformation or metabolism of the drugs. So in this case, what is the metabolism? Why metabolism essential? Why biotransformation is essential? So biotransformation and metabolism nothing but is the chemical conversion of the one substance to another substance. So means if you are using the lipid soluble drug or a non-polar drugs, what will happen? They will go for the metabolism or the biotransformation, and they should be converted into. If you are using the lipid soluble drug, it will be converted to water soluble drug, or if you are using the non-polar drugs, it should be converted to polar drugs. So if it is converted to water soluble drugs or a polar drugs, then can be easily excreted through the renal route. So that's why it is called as the renal excretion will be there. So most of the drug will be excreted through the renal route only. So that's why for this reason you have to use to conversion or the biotransformation is required. So if you are using the lipids, suppose there is no biotransformation or metabolism is not there, then what will be happen? So that's why what will happen if you are using the lipid soluble drug, what will happen? They will be partially reabsorbed from the renal tubes to the blood. Then after this process will be continue for a longer period of the time. What will happen? All the drug will be accumulated in the body. So then the tissue toxicity will be occur, or the precipitation will be occur. So then to prevent this tissue toxicity or the prevention of the precipitation fall, so it should be the biotransformation or metabolism is very, very essential. So that's why the lipid soluble drug or a lipophilic drugs or a non-polar drugs should be converted to water soluble or polar drugs. For this region, your biotransformation or metabolism is required. That's why it is called as the one form to another form, means chemical conversion of the one form to another form. Then what is in this biotransformation? There is a one term we are using. It is called as the xenobiotics. So xenobiotics is nothing but this is not the all are the chemical substance that are not needed for the body. So xenobiotic means it is a one type of the foreign substance or exogenous substance which will be entered to your body by your injection or by inhalation route. So that's why this foreign substance would be there. Then how it will be occur in the drug metabolism? So if you see the xenobiotics, for example, already discussed the highly lipophilic drug metabolically stable. There it will be accumulation in the body, means it is called as the storage in the body tissue. Then there will be go for the phase 1 metabolism. Phase 1 metabolism, it is called as the non-synthetic reaction will be there, or the metabolic pathway, chemical pathway will be there, like phase 1 metabolism, like oxidation, reduction will be there. Then after this they will be converted to polar. Then again it will go to your phase 2 reaction like conjugation or methylation reaction will be there, the synthetic reaction. Then after this it will be converted to hydrophilic, means it will be converted lipophilic, will be converted to your hydrophilic in nature. Then after this it will be excretion by the renal route. So they divided into four categories. One then four categories like this: highly lipophilic, metabolically stable, accumulation. Then you would go to phase 1 metabolism, then polar, then phase 2, then hydrophilic, then excretion. Similarly, lipophilic, phase 1, like this all process are same. If you are using the polar, directly it will go to your phase 2 metabolisms. Then after this hydrophilic, then excretion. If you are using the hydrophilic drugs, obviously it will be directly, it will be excretion. There will be no metabolism is required. So directly the renal excretion will be there. So this is the introduction of your biotransformation or metabolism of the drug. Next you are discussing about the function or the application of the metabolism of the drug or the biotransformation. Now the function of the biotransformation, the category. So now the function of the biotransformation, they category into the four categories. One is pharmacological inactivation, second one is the no change in pharmacological activity, third one is the pharmacological activation, and fourth one is the change in the pharmacological activity. So in the pharmacological activation means example is active to inactive. This is called as the pharmacological inactivation. After biotransformation, what will happen? What the active drug they are using, after transformation they will be converted to inactive form. There is no pharmacological action will be there. So phenytolamine, it will be inactive by transformation. It will be go to your phenyl acetone. Similarly, the phenytoin, it will be converted into para-hydroxyphenytoin. So these are the inactive form will be there. That's why it is called as the pharmacological inactivation after the biotransformation. Similarly, after biotransformation, what will happen? There will be no change in the pharmacological activity. What you are taking the drug after biotransformation, same activity will become. So it is imipramine, desipramine, codeine, morphine, digitoxin, digoxin, but their action is very same. Same active will be there. Then come to your pharmacological activation. So if you see the inactive drug, means it is called as the prodrug. So inactive means it is in the form of the prodrug. So they have converted to active form. That's why it is called as the pharmacological activation. Here first one is the inactivation. So here is the prodrug, means like aspirin will be converted to salicylic acid, and enalapril it will be converted to enalaprillate. So this is about your pharmacological activation. Then next last one is change in pharmacological activity. So after the biotransformation or metabolism of the drug, the drug activity will be changed. Means pharmacological activity will be changed. Means diazepam they will be converted to oxazepam. Diazepam generally you are using as a tranquilizer, but after the metabolism when you will convert it to oxazepam, it can be used for your anti-convulsion purpose. So these are the about your the function or the application of the biotransformation. Then come to the what are the organs or the site of the drug metabolism. The liver is the major site of the drug metabolism. It is called as the metabolizing organ, or the enzymes is the liver is the first primary site. Then secondary site is like this, all our parameter will be there. Means all our organs will be there: kidney, lungs, testes, skin, intestine, placenta, adrenaline. So these are called coming under your the secondary sites, like the brain, placenta. All are the little means metabolism organ will be there, or organism will be there. So if you see the order of your drug metabolisms, liver is the first, already I told, the primary site. The major site of the drug organ metabolism is the liver. Then come to the lungs will be the next stage. Then kidney, intestine, placenta, adrenal, and skin. So these are called as the order of the drug metabolism organs or the enzymes. So this is about your function of the biotransformation. Then if you see the enzymes, one is the microbial enzymes, another one is the non-microbial enzymes will be there. So next class we will discuss about the factor affecting biotransformation. So in this factor affecting biotransformation, enzyme induction and enzyme inhibition is the very important parameter we have to discuss. Now I am discussing about the factor affecting biotransformation or metabolism of the drug. So first point is the physiochemical properties of the drug. Second is the chemical factor under this induction of the drug metabolism and inhibition of the drug metabolism. Then third one is the biological factor. So under here the species difference, strain difference, sex difference, age, diet. And then come to your altered physiological factors like your pregnancy, hormonal imbalance, and disease status will come, states will come. Then seventh one is the temporal factors. So in the cardiac rhythm will be there. Out of these 7 factors, what will happen? The chemical factor is very important. So we will discuss about the induction of the drug metabolism and inhibition of the drug metabolism. Before this, the physiochemical properties of the drug means it is coming under your molecular weight of the drug, means molecular size and the shape of the drug. Then next one is the degree of ionization of the drug. Degree of ionization means whether it is ionized or unionized drug, how your metabolism will be affected, you just have to find out. The next one is the lipophilicity of the drug. Whether you are using the when you are using the lipid solubility of the drug, how your metabolism will be occur. So in this lipophilicity, when you are using the lipid soluble drug, what will happen? It will be partially reabsorbed by the renal tubes into the blood, then glomerular filtration. If your accumulation will be there, then in these cases you have to convert the lipophilicity of the drug to the water soluble drug or the polar drugs. Then next one is you have to discuss, you have to know about which type of drug you are using, either acidic drug or a basic drug you are using. So then it will be how it will be effective for your biotransformation. This is about your physiochemical properties of the drug. Second one is the chemical factors. In the chemical factors, the induction of the drug metabolism and inhibition of the drug metabolism. Now we will discuss about the induction of your drug metabolism. So induction of your drug metabolism means this is the it is the increase the drug metabolism ability of the enzyme by the several drug. It is called as the induction of the drug metabolism. Means it will increase the drug metabolism ability of the enzyme by the several drugs or chemicals. Then it is called as enzyme induction. Then the agent which brings such effect means effect means it is enzyme induction is occurring, then it is called as enzyme inducer. Means enzyme inducer is responsible for your enzyme induction. So what do you understand? If you increase the drug metabolism ability of enzyme by the drugs or chemicals, then it is called as enzyme induction. Means increasing the drug metabolism ability will be increased. Then what is the properties in the enzyme inducer? Now they may be the lipophilic in nature, and there will be the large biological half-life. They will be lipophilic in nature and large biological half-life. Then come to your application. So in this application, when your drug metabolism ability will be increases, obviously what will happen? Your pharmacological activity of the drug will be decreases. So there is a decrease in pharmacological activity of the drugs. The next one is it is increase the activity where the metabolites are active. It is increase the activity where the metabolites are active. Means activity means the metabolism activity will be increases if your metabolites are very, very active. Then next one is obviously it will be alter or change the pharmacological means it is called as the status due to metabolism of endogenous compound. So if you are using the endogenous compound, metabolism of endogenous compounds, your pharmacological action or the status will be changed. So these are the called as the application of your enzyme induction. Then come to what are the types of enzyme inducers you can use. What are the types of the inducer or the enzyme inducer? One is the phenobarbital type inducer. Second one is the polycyclic hydrocarbon inducer, and third one is the self-induction or auto-induction. Self-induction means it will be stimulate their own metabolism. By their itself drug only, your metabolism will be increases. That's why it is called as the stimulator of their own metabolism. So these are the three classification will come: phenobarbital type inducer, polycyclic hydrocarbon inducers, then self-induction, or you can be called as the auto-induction. Means it will be stimulate their own metabolism. For example, carbamazepine, then rifampicillin. So these are the drugs which are coming under your self-induction. Means that itself only they will be increase their drug metabolism activity. Then come to the what is the mechanism behind the induction of the drug metabolism. What will happen? It will be increase the both liver size and the liver blood flow. So both the liver size as well as the liver blood flow will be increases. Second one is it will be also increase the both total and microsomal protein contents. What are the protein content? Microsomal protein content will be there. It will be increases. Both total and microsomal protein content will be increases. Another one is it will also increase the stability of the enzymes. The enzyme activity or the stability also it will be increases. Second one is also, fourth one is also it is increase the synthesis of the cytochrome, means P450. So the synthesis obviously it will be increases. Then fifth one is it will be degradation of the cytochrome. So means degradation will be decreases. Means it is one way it is called as the increase the synthesis of the cytochrome. So these are this mechanism of the your enzyme induction. One is it is increase the both liver size and liver blood flow. So increase. Second one is increase the both total and microsomal protein content, and third one is the increase the stability of the enzymes. Then fourth one is synthesis of the cytochrome. Synthesis increase the synthesis of the cytochrome. Then decrease the degradation of the cytochrome, P450. So this is all are about your mechanism of the enzyme induction. Then what is the examples coming under your enzyme inducer or the enzyme induction? One is what are the inducer they are using, and a drug with metabolism. One is barbiturates, and drug which are the drugs increase the metabolism, like under your barbiturate inducer, the coumarin, phenetines. COUMARINS, coumarins and phenetoin. Similarly, if you go for alcohol, one of the inducers, then the pentobarbital or phenobarbital all are coming under this category, which will be increase the metabolism ability of the enzymes. Then phenetines, it is also the inducer where the which type of drug are coming under coumarin and oral contraceptives. These are the drugs which will increase the metabolism activity. Then cigarette smoke, another one is inducer is cigarette smoke, where which drugs are coming in nicotine and aminoacidides. These are the drugs are coming under which they will increase the metabolism. So these are about your enzyme induction. So this is the increase the ability activity, then it can be called as the enzyme induction. The agent which are bring such effect is called as enzyme inducers. Then properties already discussed. They will be in lipophilic nature and their biological half-life also it will be increased. Then application, obviously your enzyme activity is increased means it will be decrease the biological actions and alter the pharmacological station, and also their metabolic activity also it will be increased. Then types of inducer and mechanism also I already discussed. Increase the stability of the enzymes, liver size and liver workload will be increases. Synthesis also will be increases of your cytochrome. Degradation of the cytochrome will be decreases. So these are this what is called as the mechanism. Then examples. The next parameter is very important is like this enzyme induction. Similarly, it is coming out the enzyme inhibition. Means inhibit means it will be decrease the drug metabolism ability of an enzyme is called as enzyme inhibition. Means here is induction means increasing, the inhibition means it will be decrease the drug metabolism ability of an enzyme is called as enzyme induction. The types is the direct and indirect. Direct means competitive inhibition, then next one is the non-competitive, and third one is the product inhibition. The three coming under your direct. Then indirect means the repression and alter the physiology. So these all are fives are coming under your direct and indirect inhibition. Then come to your competitive the inhibition. So in the competitive inhibition, what will happen? The drugs are structurally similar compounds. They compete for the same site of here the enzymes. So there will be the competition between the two drugs. Means the structurally similar compounds compete for the same site of an enzymes. Then, for example, metacholine, and they will be decrease the metabolism of acetylcholine. If you see the methacholine and the acetylcholine, the structurally the similar structure will be very similar, but the metacholine is decreasing the metabolism of acetylcholine. That's why the name indicates it is the competitive. So that's what means the structural similar compounds compete for the same site of enzyme. The non-competitive means the structurally the different compounds compound will come. Means when the structurally unrelated compounds interact with the enzymes and the prevents the metabolism. First one is they will be unrelated compounds, means structurally they are not similar. Another one is they will be also prevents the metabolism. So what is example? Now isoniazide is decrease the metabolism of phenytoin. They will be inhibits the metabolism of phenytoin. Isoniazide will be inhibits the metabolism of phenytoin. That's why it is called as the non-competitive. Then come to your product inhibition. It is similarly like your self auto inhibition, or you can be called as self inhibition. Either as self or auto inhibition, or you can be called as the product inhibition. Means that when metabolic products compete with the substrate of an same enzyme, then it is called as auto inhibition. The metabolic product compete with the substrate of the same enzyme, then it is called as self inhibition. It is called as the auto inhibition. Then in come to your indirect second parameter. One is the repression, another one is alter physiology. Repression means it will be decreasing the enzyme content. It will be depression means it will be decrease the enzyme content. Another one is it is maybe due to the fall of the enzyme synthesis. If your enzyme synthesis will be decreases, that's why your enzyme content will be decreases, and the metabolism also it will be decreases. That's why it is called as the repression. For example, the puromycin, this is also one of the drug where the enzyme synthesis will be decreases. What happens? The enzyme content will be decreases, and then your inhibition also it will be there, it will be occur. Then come to here the alter physiology. Alter physiology means it is due to the nutritional deficiency, or you can be called as the hormonal imbalance. Due to your hormonal imbalance or a nutritional deficiency, the physiological action will be decreases, means your inhibition will be occur, enzyme inhibition will be occur. This is about here the indirect method, means alter physiology. Then what are the examples are coming under here the enzyme inhibition? One is the MAO inhibitors. That what are the drugs are coming under your this inhibitors category? Now barbiturates. Another one is coumarin, means phenytoins. So these are these inhibitors with the drug which will be decrease the metabolism of the enzyme. So these are about your enzyme induction as well as enzyme inhibitor. Is very important. So if you understand, enzyme induction means increasing the metabolism ability of the enzyme. Enzyme inhibition means it will be decreasing the drug metabolism ability of your enzymes. The next one is important parameter is what are the chemical pathways? These are the factor affecting what I am discussing, and the biological factors just you to study species difference, strain difference. If a species difference will be there, what will be the happen for the biotransformation like this? Strain difference, sex difference, age, diet, and alter the physiological factor. Already one point I discussed, the hormonal imbalance or pregnancy will be there, disease states will be there. What will be happen here? Physiological factors. Then temporal factor is the cardiac rhythm will be there. So these are coming under a factor affecting biotransformation. Then the next important parameter is what are the metabolic pathways, or it can be chemical pathways will be there for the biotransformation. So what are the chemical pathways or the metabolic pathways? There are divided into two categories. One is phase 1 reaction, phase 2 reaction. Phase 1 reaction is called as the non-synthetic reaction. Phase 2 reaction is called as the synthetic reaction. So phase 1 reaction, what are these are there? Now oxidative reaction, then reductive reactions, then hydrolytic reaction will be there. So under your oxidative reaction, if you see there are so many parameters will come under your oxidative reaction, like the oxidation of aliphatic carbon atoms, then oxidation of acyclic carbon atom, then oxidation of carbon hetero systems, then carbon nitrogen systems, carbon sulfur system. So many parameters will come under your oxidation reactions. So then come to your reductive reaction. In the reductive reaction, it will come under your reduction of your carbonyl functions like aldehyde ketones. Then next one is the reduction of your alcohol and carbon-carbon bonds. Then the reduction of the N compounds like the nitro, azo, and nitro oxides. So these are coming under your reductive reactions. Then come to your hydrolytic reaction. So under your hydrolytic reaction, it is the hydrolysis of the ester, ether, hydrolysis of amides, hydrolytic dehalogenation. So these are these parameters you have to study. So this is coming under your phase 1 reaction. Then come to your phase 2 reaction. Mainly it is coming under your conjugation reaction, acetylation reaction, and methylation reaction. So under your conjugation reaction, it is conjugation of the gluconic acid, conjugation of the sulfide moieties, conjugation of the alpha amino acids, then conjugation of the glutathione. So these are coming under your conjugation reaction. Then next one is the acetylation and methylation. If your reaction is occurring, all the reactions are there, either synthetic or a non-synthetic reaction is there, how your metabolic will be affected. So these are the parameters already you have to study. I sent the material just to go through the materials, and these are about your factor affecting biotransformation and also enzyme induction and enzyme inhibition. And now I think the drug metabolism I have completed somewhat. So next we'll go for the next chapter, we'll go for this excretion, drug excretion or the drug elimination. Thank you.